I welcome you all from wherever you may be watching us. And today I want us to have a look at hematemesis. And hematemesis is one of the common gastrointestinal presentations that most of the patients do present with. Now to begin, it's important for us to understand what hematemesis is. So hematemesis simply means vomiting of blood. And it's important to note that this is a medical emergency. And it is a life-threatening condition or presentation that any patient who develops hematemesis or vomiting of blood should be treated with an urgent attention as much as possible. Now, there are several causes of hematemesis, and we are going to have a look at the list of the causes of hematemesis. And I want us to take note that this list is not conclusive, but rather highlights the most common causes of hematemesis. Now, the first one is called bleeding ulcers. For example, peptic ulcer disease, or even gastroesophageal reflux disease, what is simply referred to as GERD. The next cause of hematemesis is acute inflammation or acute inflammatory processes. For example, gastritis or even esophagitis. The next cause of hematemesis is called portal hypertension, as seen in patients with liver cirrhosis. The next cause of hematemesis is called chronic pancreatitis, and this simply means the inflammation of the pancreas. The next cause of hematemesis is traumatic injuries. For example, accidents, or even sometimes penetrating or even blunt abdominal injuries. The next cause of hematemesis is referred to as tumors, and in this case, we can either have benign tumors or even malignant tumors. For example, tumors of the esophagus, which is referred to as cancer of the esophagus, or even the cancer of the gastric or cancer of the stomach. The next cause of hematemesis is referred to as Mallory-Weiss syndrome, or simply the Mallory-Weiss tear, which is also very common among the alcoholics or those who take heavy alcohol. The next cause of hematemesis is referred to as radioactive poisoning. So this is from radiations. The next cause of hematemesis is hepatitis, particularly the viral hepatitis. The next cause of hematemesis is referred to as cystomiasis or schistosomiasis infestation, that is more of a parasite. And the most type is referred to as Schistosoma mansoni, which causes hepatic schistosomiasis or even intestinal schistosomiasis. The next cause of hematemesis is referred to as iatrogenic causes, as seen in procedures such as endoscopy. The next cause of hematemesis is referred to as arterioesophageal fistula. This simply refers to a communication between the atrium or the atria of the heart and the esophagus. The next cause of hematemesis is called yellow fever, and this is also very common. Other causes of hematemesis also includes drugs, and in this case, the most common class is referred to as the anticoagulants. Anticoagulants are blood-thinning drugs, for example, warfarin and heparin. The next cause of hematemesis is referred to as esophageal varices, and this is also a very common condition. Certain blood disorders, for example, hemophilia, can also cause hematemesis. Now, ladies and gentlemen, just as I have mentioned at the beginning, that hematemesis is an emergency. It's actually a life-threatening condition. Should you come across any client who has developed hematemesis, kindly make quick referral to the nearby health facility for an urgent medical intervention. Should you as an individual develop hematemesis, kindly rush to the nearby health hospital for immediate medical intervention. If you are watching us for the very first time, kindly subscribe. And until next time, it's goodbye from all of us.